Good morning and welcome to SHAC in Action, Partnering for School Health. I'm Michelle Smith, the State Coordinator for Action for Healthy Kids. Sarah Jefferson, who's with It's Time Texas, our partner in presenting these webinars, is having some technical issues. So she's not able to launch the webinar for us this morning. But we do appreciate working with It's Time Texas, and they sponsor our webpage. If you're looking for information on School Health Advisory Councils, you can go to itstimetexas.org/SHAC. So we are thrilled to have with us today Nora Gimple with Dallas ISD. She's the SHAC co-chair, and she's also the PTA Healthy Lifestyles Chair. And then Barbara Johnson, who is the Director of Health and Physical Education with Dallas ISD. They both work extremely hard, along with their board, to get a great recess policy passed. So we will just get going so we can share some great information if I can. There we go. So I'm going to briefly do just a very few slides on the laws as they relate to recess and physical activity and School Health Advisory Council. Then we'll have our two speakers, and then at the end I've got a few resources and things to share. I will tell you there should be a control panel with a box where you can put questions in. So if you have questions, please, don't wait till the end. Go ahead and send your questions in early, and we will get to them. Nora is only going to be able to stay with us until noon, so if you have questions for her, go ahead and send those in, and we'll get her to answer those before she has to hop off and go to a meeting. And then Barbara and I will be around. And we can also send you answers after the webinar as well. There's a new feature that we're using this time for handouts. So you should see in your control panel a group of handouts. Right now there is the Austin ISD SHAC recommendation, the PowerPoint that Austin ISD was using to present to our SHAC on recess, and then hopefully to share with our school board. And then the presentation that we're doing today is on there. So you should be able to download those. We will add some additional files as we during the presentation. I believe I'm going to add a couple more files that you can also use. So let's get started. All of you, or most of you, probably are aware that School Health Advisory Councils are district level. There can be campus level councils, but the ones that we are working on and trying to assist are the district level councils that were developed to make sure that community values and parental values are reflected in the health education instructions for the district. They are mandated by state law. They should be or mandated to be appointed by the school board. They are a voice for parents and the community, as we mentioned, and they're the best way to share important information and share with the board and the district why health is so critical to the success of our students. They are responsible for reviewing all health education curriculum, and not just once, but whenever it's revised, the SHAC should be involved in those revisions. They make recommendations on health-related topics. They are responsible for reviewing and recommending recess policies, and as part of that, they are to review statistical information from the district as they're making those decisions, as well as national best practice information. They're also mandated to review and make recommendations on joint use agreements or school district community collaborative strategies, so that your community is able to access school property when possible to improve their ability to have physical activity. A few of the laws or things that are part of the law. When it was created, SHACs were having issues with the fact that they were a lot of times being run by school personnel or superintendent, and the intent was to make sure that parents had a voice, the community had a voice, So the law was changed to mandate that the chair or a co-chair must be a parent who is not employed by the school district, so that there was not this fear or intimidation that could possibly take place if it was a district employee. They are to report yearly to the school board, preferably with a verbal report as well as a written report if possible. They are now required to meet at least 4 times annually. Some of the SHACs were only meeting once a year, and you really can't be very effective if you don't meet at least 4 times a year. There was a minimum of 5 members set, so that there would be at least 2 to 3 parents, as well as 2 people who could be from the district. And as I mentioned, 50% or more of the SHAC must be parents who are not employed by the district. It's not that we don't want parents who are employed by the district, but we want to make sure that there is a good percentage of parents who are part of the community at large. The newest mandate around physical activity is there was a mandate to have a subcommittee or a committee that reports to the SHAC, as part of the SHAC, to work on physical activity and fitness planning. Must consider issues relating to the student physical activity and fitness, and make policy recommendations on how to increase physical activity and improve fitness among students. So these are things that all SHACs are mandated to take under consideration. So now I'm going to let the experts talk a little and share their experiences with their SHAC and with their resource policy. So Nora, I'm turning it over to you.
Thank you, Michelle. This is Nora Gimpel. I'm serving right now as a co-chair for the SHAC, our district. And I'm also the PTA Healthy Lifestyle Chair in our school. If you want to turn to the next slide, Michelle, I would like to share my story. And I started a couple years ago participating in the SHAC after being invited by another parent of our school, and I decided to be more active in the SHAC group, and started with a subcommittee. As Michelle mentioned, there were several subcommittees in our SHAC, and decided to be part of 2 of them, and being active with those committees. And the year after, I was selected as a co-chair, and that was a great opportunity for me to get even more information about what SHAC is, but what can be done in our school. So learning through the SHAC group and learning more about our district and many things that we could do in our school and other schools too, I decided to initiate a healthy lifestyle committee. So by looking at the rules and the policies and everything through the SHAC, I requested our PTA to start this committee. So I recruited a few parents, wonderful parents from the school, and we decided to put a committee together. And it's almost the end of the year, and we accomplished many things in our campus. I'll be happy to share many of those, but I want to mention a couple of things that we decided to do from the beginning. First of all, we recruited a few parents. We recruited other people from the campus, such as staff members and coaches and some teachers. And we developed a sort of an assessment, a needs assessment in our campus to find out what things needed to be changed in our level, campus level. And then from that needs assessment, we decided to focus on certain initiatives during the school year. And we were able to accomplish some of those, and we still have a list of things that we're going to continue doing next year. So that is kind of my my story in participating with the Healthy Lifestyle Committee in our campuses. But then I extended it a little bit and reach out to the Texas PTA level and the lifestyle resources, the lifestyle chairs resources available. So I'm in contact with the Texas PTA Healthy Lifestyle through the newsletter, and you can see in this slide there is a link for the newsletter for the Texas PTA Healthy Lifestyle, and is a wonderful resource to get information about grants and upcoming webinars and interesting articles and different things that are going on. And I'm putting here also the information, the contact person, Karen Burnell. She is the Texas PTA Healthy Lifestyle liaison, and here is her email, and please feel free to contact her. She's a great resource. Michelle, if you can switch to the next slide. I will like also to tell you more about what Texas PTA Healthy Lifestyle Group can help you with. And you can, we have done many things through our campuses and through the Texas PTA, but I would really want to, reinforce and emphasize the work that we did in terms of physical activity and how the Texas PTA was able to support and advocate for this work. If you had the chance, please look at the link that is listed here in order to see the resolutions in regards to physical activity. But the most important thing that I want to mention is the recently accomplished 20 minutes of recess for every elementary student every day at school, and those policies and procedures that we review through the SHAC and through our healthy lifestyle committees in all the campuses have a voice. And I encourage everybody that are participating in any particular activity in their own campuses to reach out to the SHAC committee of that district, and also reach out to the Texas PTA. There are many things that could be done. Usually PTAs are primarily there to help with the fundraising, with assisting the teachers, but there is much more that we can do in regards to advocate for physical activity and nutrition and many different levels. So I would, again, encourage you to, reach out to those resources that are available to you. And if you, at this point, if you have any questions, I'll take questions. I'll stay a little bit, and I'll pass it to Barbara that will tell you more about our accomplishment through our SHAC, the DISD SHAC. And I'll stay a little bit on the phone in case that anyone has some questions. Thank you.
Thanks, Nora. Did you actually have like the PTAs at the schools? Did any of them write letters, or what exactly did the PTAs? How did they help support the SHAC?
Well, yeah, we do have. Good question. So we have a email blast that is sent weekly to all the parents, and the Healthy Lifestyle Committee had a section there to inform of any of the events and things that are going on and recruitment. We had in our campus, we had this year great support from the staff members and the principal in particular to support all the initiatives that we decided to do. Like I mentioned at the beginning, we started with a needs assessment at the school and asked the parents about their thoughts, but we also did the same thing with the staff members. So all the teachers and the staff members were able to say what they wanted in terms of improving and enhancing more, physical activity and nutrition and healthy lifestyle in our campus. And so we disseminate that information through, the e-blast, and there is also the folders that go home with the kids that we also get a lot of information there. In all the PTA's meetings, we have time to report the Healthy Lifestyle Committee reports on the needs and the accomplishments.
So do all of the Dallas schools have healthy lifestyle chairs, or most of them?
I don't think so. And we recently participated with Karen Burnell in a community engagement conference here in Dallas. And we find out, we disseminated this information, but we found out that the same thing, that not all the schools might have it. Maybe Barbara will say something more about it, but I wanted to share my story because I didn't know about that as a parent in our campus. I didn't know that it needed to happen. I didn't know that it was required, that it was that we have a voice at that level. So I will continue now through my role as a co-chair in the SHAC to encourage people to come to the SHAC. That's the next level, but also try to work with other campuses and see if we can advocate for the same thing. I think all schools should have that.
I agree. I think it's important. I've noticed with my work with Action for Healthy Kids that a lot of PTAs have the program chair possibly doing healthy lifestyles along with other things, and I think it's really important if you can have that healthy lifestyle position to get that focus on more than just programs, but also on campus level policy and interacting with the site-based committee on different things that could be improved from a wellness perspective, and supporting recess at the campus level, because even though the SHAC may pass a recess policy, if you don't have that parent support at the campus, sometimes it's difficult to get it implemented. So
I think that our role is to not only promote and create maybe new initiatives at the campus level, but it's also to support and mandate what it has been approved at the district level, and be sure, as you say, that those things are happening in the way that it should happen.
Well, thank you for your commitment to not just your PTA, but your School Health Advisory Council and your children. It's a great responsibility and a lot of work, and you're doing a fabulous job, and your passion is obvious and greatly appreciated.
Thank you.
So
that's what I like to do. Yeah, thank you so much.
Sure. I'm going to now change presenters to Barbara. There we go. I think I'm going to. There you are. Okay, Barbara, you will just need to show your screen. Is it still on me? Oh, Barbara, I didn't unmute you. Can you send that back to me so I can change presenter back to me just shortly so I can go back in and unmute you? Well, let me see here. Okay. Okay, Barbara, you are unmuted.
Okay, I'm unmuted.
Now let's.
You know what, Michelle, you want to just, you can just advance the slides.
Okay.
Since we're having a little technical issue here.
Okay. Because now it's, I see you.
Yeah. Hey.
Hi there.
Yeah, I see you.
You're in my window.
You can actually see my face?
I could.
Ooh, that's bad. Okay, can you see me now?
No.
Is
Can
that
you see
better?
the,
I can see the slides.
okay.
Okay.
So there you
So
go.
if you'll go back to that first slide, I just wanted to share with everyone that Dallas ISD participated in the It's Time Texas Community Challenge along with the City of Dallas, and this was my lovely selfie of my signed pledge as the Health and Wellness Coordinator for Dallas Independent School District. And we really enjoyed participating in that and appreciate all that It's Time Texas does to support our efforts in the schools.
Awesome.
Okay, so we're going to start out with just a little bit more information in regards to our SHAC. And one of the first things I wanted to share with everyone is that even though you're hearing this information coming from Dallas ISD, and such a large urban district, 226 campuses, around 160,000 students, the information that you're receiving today is really something that would apply to the smallest of districts as well. I've been in both settings and been in a position of facilitating the SHAC in both large and small districts, and the information that Michelle and Action for Healthy Kids provides, as well as the things that are being shared with you today, truly are all-encompassing, and I think that everybody, no matter what size district you're coming from, will hopefully get some good information to take back to your district. Our SHAC action meetings occur every other month. We usually start in September. And opposite those action meetings where everyone attends, we have subcommittee meetings, and the subcommittee meetings actually schedule their own meetings, and sometimes they're virtually, sometimes they meet face-to-face in the months opposite of the action meetings. And going back to the meeting dates, the times are actually something that the SHAC votes on at our first meeting. We have the opportunity for our membership to decide what time of day would work best for our meetings to be scheduled, because we certainly want to make, our best effort to have the most participation possible. And so sometimes it may be that they decide to have a meeting in, alternating morning, lunch, and the evening. Sometimes they may decide that they just want to have all noon meetings and have it, be a working lunch or a brown bag lunch. So that's something to consider, especially I know we're all challenged with having, participation at our meetings, so that might be something that you want to think about, offering them the opportunity to vote on the time of day for the meetings. It's also always a challenge to have the majority of your SHAC membership consist of parents of students in your district. So, and I think we have seen a great improvement in our parent participation over the past 4 to 5 years here, simply by intentionally beginning our recruitment in the spring semester of the school year that's coming to an end. So currently we're getting ready to roll out, or to really have our push in regards to recruitment for our next year's SHAC. We have adopted, or actually formed our subcommittees to represent the needs and interests that have been identified by the parents on our SHAC. And so you can see that our subcommittees currently include child nutrition and wellness policy, data analysis, health education and prevention, parent and community involvement, staff wellness, and physical activity. This has really helped in regards to recruitment as well, because when we share our flyer, which I think we're going to be able to attach as a handout to this webinar, our flyer of information about the SHAC, we're able to share with the parents the various areas that we focus on, and hopefully they will see one that they're attracted to or are particularly interested in and becoming more involved and supportive of. So that's been really helpful, and I'll talk more about that, the subcommittee work, in a minute. Additionally, to increase communication between the district and our SHAC, this year we started using an electronic bulletin board, and it's called Padlet. It's actually an application that's free, and it truly is just a virtual bulletin board, and you can set up this electronic bulletin board, and the members have the opportunity to ask us questions or to seek support from the district, to share announcements that they may want to share from their community or organization or agency. And it's kind of been a neat way to increase our communication even in between meetings with our SHAC membership other than email. And in a district this size, and in really, like I said, in any size district, it's so important to have a strong infrastructure in place to support the SHAC and the district-wide Coordinated School Health Initiative. And in Dallas, we have a Coordinated School Health Leadership Team that consists of director level and above staff and as well as a dedicated position, which is our Coordinated School Health Specialist, which happens to fall under my department, that supports our SHAC directly and works with our co-chairs in developing agendas for the action meetings, as well as taking things and communicating things with the Board of Trustees. Okay, next slide. Our subcommittees do provide a report at every one of our action meetings where they come back to the group and share some of the things that they've been working on in their subcommittee work or meetings. And basically we've provided a template that allows our subcommittees to include their recommendations. They are able to share research that they've done and the connections to particular recommendations or their goals. They can share how they have considered policy in their recommendations, and also their goals for the upcoming year. So our board report, which is shared annually with our Board of Trustees, includes as exhibits these subcommittee reports, and we consolidate the recommendations into our general report that we share with the board, but this also gives them significant background information in regards to how these, where these came from. How did these recommendations come about? And so we found that very helpful, and in providing this in both written form as well as face-to-face presentation to our trustees. And next, the next slide is a representation of a SHAC recommendation that involved physical activity. It came from our physical activity subcommittee, and this sample that I wanted to share with you, it really represents a couple of different things. One thing that it represents is the importance of developing partnerships in the community and involving them in your SHAC. It can really lead to great things, and this is an awesome example of that. Through our partnership with Children's Health, all Dallas ISD teachers now have access to Go Noodle Plus, which is a web-based resource that encourages teachers or supports teachers in utilizing activity breaks throughout the school day. So Go Noodle, the website Go Noodle is free to anyone. Anyone can go on there and set up your own account. Go Noodle Plus is kind of like Go Noodle with just some extra components, more activities that are aligned to the core content areas, and some different opportunities, options for teachers to create their own, embed their own questions and lessons. Through a SHAC recommendation and our collaboration with this partnership, we were able to very successfully implement Go Noodle and the use of it district-wide. And it has really taken off. Obviously, with the numbers there, you can see 11,613,550 minutes of student physical activity in the classroom since August 1st of 2015. So that's just since the beginning of the school year. And over half, and I think that number may have increased to over 60% now of our Dallas ISD elementary teachers and some of our middle school teachers are utilizing Go Noodle. So, and also in regards to this, and this is one of the success stories, but definitely, we all know that while many of our SHAC recommendations, or all of them, will help the district, not all of them have been successfully received. And for example, recently with House Bill 5, when the state of Texas reduced the graduation requirement from 1.5 credits of physical education to only 1 credit of physical education for graduation, our SHAC recommended to our board that we keep the requirement in local policy. And in the past, our board had kept that in place even when the state lowered it. But with House Bill 5 recently, since there were so many other changes and requirements in regards to what the students were, endorsement pathways and things, the board did not maintain the 1.5 physical education requirement, which is what the SHAC was recommending. They did, however, support the SHAC recommendation to keep the 0.5 health education requirement, which currently there is no graduation requirement for health education in the state of Texas anymore. Fortunately, most of the school districts that I know of in the state did keep it. I would say the majority have, and certainly the Dallas ISD has maintained that credit requirement as well. So the next slide, Michelle. So the School Health Advisory Council initiated a discussion and consideration of daily recess requirement. during our last biennial review of our district's wellness policy. And after a recommendation from the SHAC of a mandatory daily 20-minute recess, the SHAC recommendation was to have a mandatory 20-minute daily recess. At that time, it was actually changed by the district to a should have an opportunity to engage in unstructured recess, so there wasn't a mandated required specific allocated time for recess. So this year, and this is something we're so excited about, we had a group of parents and our SHAC involved in asking the district to consider a required 30 minutes of recess or playtime, unstructured play per day. And we had a group of parents that established a petition asking for that. And within that information that was provided to the board, the parents also noted that even though recess has been a part of the school day for many of our schools, they felt that, and they were experiencing the fact that oftentimes it was reduced or it was inconsistent. So they wanted to go back and ask the board again to consider having it be a mandatory recess time. The parents provided argument and research to support the fact that recess is a major part of a child's learning development, but that over the past few years, the break time or the recess time was decreasing with the teacher's focus and the school's focus on meeting new testing standards and state assessments. So I could just say that, and you know, as this slide says, is if at first you don't succeed, call it version 1.0, because you can always come back. And this is exactly what happened with our SHAC and our parents who were so diligent in their advocacy work in regards to the importance of having this time integrated into the school day. And that's really the best thing that I can recommend that schools do, is to try to incorporate these policies on a district by district basis. And remember that you can utilize your wellness policy, which is a federal requirement. So there's things that are doable at the local level, even when it's not supported at the state level. So just to keep that in mind. The Dallas ISD Board of Trustees recently approved a policy to make sure that all students from pre-kindergarten through 5th grade get mandatory recess every day. So for the rest of the school year, our kids will get at least 20 minutes of recess, and starting next school year, they'll get at least a half an hour. Also, as part of the policy, students cannot have recess withheld as punishment for minor offenses, and recess does not replace student participation in a standards-based physical education class for at least 135 minutes per week. So recess is in addition, mandatory recess is in addition to the 135 minutes that our students are getting at least per week in a physical education classroom setting. In Dallas ISD, we're going to be providing equipment for every campus because we know the value of having options for the kids when they do go out on the playground, and the safety concerns and things that that could arise if they do not have some different options for play. The district is going to be investing in some, we are currently looking at ordering equipment for every campus. We will be providing training for the campuses to hopefully support their successful implementation of the new policy, and developing a recess guidebook that we'll be sharing electronically with all of our schools. The next slide. I don't think I mentioned, but there was a survey done by the district. This was after the parents brought it to the attention again. The district conducted a survey that found that roughly 78% of Dallas ISD elementary schools already offered daily recess, but that they were providing only 15 minutes or less. So the survey found that only 3%, compared to 78%, that only 3% of the elementary schools allowed students to have recess for 20 minutes or more. As part of the research on why recess is important to the development of adolescents, the SHAC, or our School Health Advisory Council, through the leadership of and oversight of the Health and Physical Education Department and our coordinated school health specialist, had some discussions and did some research with Dr. Ray at TCU, which I don't know if you all know, but Dr. Ray is the founder of the LINK, Let's Inspire Innovation in Kids project, in which she is striving to measure and monitor the impact of multiple recesses in schools. So in addition to Dr. Ray, many scholars have referenced how schools in Finland drastically improved their academics by placing an importance on play, unstructured and outdoors, and physical education structured to be included in the curriculum from grades 1 through 12. So in Finland, 15 minutes of recess is required for all students, for all schools, for every hour of academics. So the question that we might all be asking ourselves is, you know, why have we seen such a decrease in recess time over the past 20 years? Because we can all probably remember recess. It's probably one of your most favorite things that you remember about elementary school. But we all know that we've seen it decrease, and in some circumstances, in some schools, it's actually disappeared. And I think that if you ask yourself that question, and in schools we ask ourselves that question, it's because of the importance, or the fact that schools felt that they had to put more importance on a test score, and that time was better utilized in other ways to focus on improving those academic standings and academic performance. But what we're finding, and what all the research is telling us, is that as far as that goes, we're actually benefiting the kids more in regards to their academic performance and their ability to learn by providing them this unstructured time, and to have them be more physically active and involved in those types of activities throughout their school day actually helps keep them more focused on their academic studies. And as well as, and in addition to that, I just wanted to add one more thing, and also you know, the opportunity to play and to have this unstructured time, you know, is also linked to fewer behavioral problems. The students are less anxious, they're happier, they, you know, we see improvement in their behavior or their character. Their attendance is improving, you know, as well as, of course, the academic achievements. So how did this happen? The first bullet here is truly the most important piece. The parents argued, and the parents' advocacy for the importance of recess, that it is a major part of a child's learning development, and that over the years that time had been decreasing. That was probably the most critical piece. And by parents, I mean the parents that were involved in PTA at the campus level, as well as the parents that were involved at the SHAC level as well. Again, the best thing that school districts can do is incorporate these policies on a district-by-district level. If we don't have the support from the state level, then there's ways to you know, to develop it within your district at the district level. Having it be a part of the instructional day, not just in addition to, having it be a part of the instructional day is going to be key to successful implementation and ensuring that there will be dedicated time carved out of the day to support implementing the mandatory recess. Making sure that it can't be taken away as punishment. There's other ways, and working with your school district and the folks at your school in what else can we do other than taking away recess to help redirect our children's behavior. And of course, primarily the hard work from the SHAC. Visibility of the SHAC, promotion of parent participation is so essential to the success of any of these health and wellness related initiatives. The SHAC, the photo here shows a SHAC booth that was at our district STEM Day. The STEM Day in Dallas attracts, gosh, probably 3,000 attendees. So as a part of that, we took advantage of that opportunity. We had SHAC parents there. We had, in that photo there is one of our dads here from Dallas ISD. The booth was interactive. It got the attention of the students as well as their parents, and while we had their attention, we gave them information about SHAC and how they could be a part of the group. So finally, I just wanted to share the new policy verbiage with you, and so you'll have this in the I know Michelle is attaching the a copy of this PowerPoint presentation. So again, previously the policy related to recess was in FFA regulation, which was a part of our student wellness, welfare, wellness, and healthy services, our local wellness policy. This policy is in local policy, in e-policy, which puts it in the instructional day, scheduling and instructional arrangements for the day. So that's key to implement, you know, hopefully more successful implementation. So we'll just read that very quickly. The policy states, recess is defined as a break period, typical outdoors for children to play. During recess, adults should help orchestrate play to encourage healthy student-to-student interactions, but should not provide structured instruction. In addition to other guidelines adopted, the superintendent of schools shall ensure that all elementary campuses offer recess a minimum of 30 minutes each day for all students in pre-kindergarten through grade 5, beginning with the 2016-17 school year. For the remainder of the 2015-16 school year, the superintendent of schools shall ensure that all elementary campuses offer recess a minimum of 20 minutes each day for all students in pre-kindergarten through grade 5. Physical education cannot be substituted for recess. In addition, students should have access to either physical education classes or additional recesses a minimum of 3 days per week. Students may not be barred from recess as a form of discipline for any level 1 offense, and administrators are discouraged from limiting access to recess as a form of discipline generally. So if you're interested in more information for our Dallas ISD SHAC, we have a web page set up on our district website. And so feel free to go there or to contact me if you have any questions. Thank you.
Thanks so much, Barbara. That was great information. I'm excited about the information that you guys have shared. A couple of things that resonated with me and what we're doing in Austin is I really like the petition from the parents. I remember just at a school level doing a petition from parents on recess when my children were young, and you're talking 20 years ago, we were having issues with recess. And we got the parents and signed a petition, and we had recess back really quickly because there wasn't one parent that I know of that wouldn't agree that our children need that time. The other thing I think that's important when you're working on the recess policy is making it part of the instructional day, because if it's put into that part of the policy like Dallas did, then it's pretty much guaranteed it's going to happen. What happened in Austin with our policy was it got recommended and that it be included, and it was not policy. So while over 50% of our schools are doing recess, it's whenever they decide they want to, and it's not, required. It's not stated that it can't be used as punishment. It should not be used. So making sure the language is such that it's mandated is really important, I think, for that. Are there any questions for Barbara about recess policy? I haven't got any in my box right now. Excuse me. You did notice, like as I mentioned, there are handouts in there. This presentation's in there, and there's a couple of other things from Austin. I did not get the other handouts in before we started, and I can't access my email right now, so I can't load them. But I can send those out when we send out the link for this. We've also got some other SHAC resources that are part of this presentation, and you'll be able to access those if you download the presentation. The School Health Policy Database from NASD is a great place to look at specific policies. The Whole Child, Whole Community, Whole School, which I always do back, but I think the child should be first. At the CDC is basically an expansion on the coordinated school health model. Then there's some specific sites you can go to for information on improving certain areas like school food and beverage. CDC School Health Index, which is the preferred assessment tool. Then DSHS has a SHAC guide, which can be downloaded from their website. PTA has their Healthy Lifestyles Chair information. There's Department of Agriculture and TEA, as well as It's Time Texas on there. And then taking you specifically to the laws that are on the TEA website. Excuse me. These are basically coordinated school health links, as well as, again, the CDC assessment tool for school health indexes. And just so you know, the Austin School Health Advisory Council PowerPoint that's on there is the one that we use to present to our School Health Advisory Council to review and make recommendations on recess. And if you'll notice at the bottom of the screen, there's a Study Break School Sees Positive Difference. That is a link to the one of the stories on the Fort Worth recess. The link, if you're looking for information on LINK, it's LIINK project. There's 2 I's in LINK. And this takes you to a story that was on NBC about the impact of that recess. And I think that one study, or the studies that she's doing, has been such a great opportunity for us to show how effective recess is, and gives us a lot more ammunition to use to get recess implemented in our school districts. So hopefully that information, as well as I think I also included the Austin, what we just presented to our district, and hopefully it will be presented to the board over the summer for a recess policy for Austin ISD. And we definitely included Dallas's recess policy in our presentation to just show that, you know, the bigger guys are doing it. It's time for Austin to get on board. I do agree with Barbara that all of this information is applicable regardless of your district size. You know, there's a lot of great implementation ideas here. I think that's part of the key. If we get a policy at a district level, as long as the principals are on board and understand how to help implement recess, I think that's critical. So making sure that's part of the piece, and that's one of the things that our SHAC is working on right now in Austin, is if they pass this policy, providing the schools scheduling options, ideas for how to do recess indoors when it's really hot or when it's really cold or if it's raining, making sure they have all the tools they need to implement effective recess policy, and also ideas on alternatives to taking recess away, and information that shows them how important recess is to improving behavioral issues. So, Barbara, do you have anything else you'd like to add?
No, I don't think so.
We hope that this has been helpful. I will send out a link to everyone who registered with the recording, and we'll include the handouts that we didn't get up on the site. Please let me know if you were unable to download those handouts. This is the first time we've used that feature, and I'm hoping it worked well for everybody. Thanks for your time today, and I hope that you're successful in getting the children in your district on board with recess, and I hope that you're able to work with your PTA. Parents are the key to pushing these type of mandates forward. If the parents are behind it, then the school board is usually going to listen. So good luck with your recess policies. And Action for Healthy Kids is available if you have questions or you need information. We also have some handouts on recess that might be helpful as well. So enjoy the rest of your day, and look forward. We do have one more webinar in May on First School Health Advisory Councils. So you can check the Action for Healthy Kids website at the national website, and look for the Texas team page for information on that final webinar. I believe it's going to be on coordinated school health and campus improvement plans, the mandates that are part of that as well. So have a great day, and we will sign off.